Hello, my name is Nicholas Cohen. I'm a primary care doctor with a practice in downtown San Francisco. I created HealthScore. HealthScore is a comprehensive program to optimize health and extend lifespan. Today, we're in the domain of psychological health, and we're talking about anxiety. The recommendation is recommendation number 6, treat anxiety. Let's take a closer look at the definition and prevalence of anxiety. Generalized anxiety disorder, which is what we're talking about when we refer to anxiety, is defined as persistent and excessive worry about a number of different things. GAD, or generalized anxiety disorder, is diagnosed when a person finds it difficult to control worry on more days than not for at least 6 months and has 3 or more of the following symptoms: feeling nervous, irritable, or on edge, having a sense of impending danger, panic, or doom, having an increased heart rate, breathing rapidly, sweating and or trembling, feeling weak or tired, difficulty concentrating, having trouble falling asleep, experiencing gastrointestinal problems. This is the generalized anxiety disorder screening instrument called GAD-7 for the 7 questions. And I recommend you pause and to calculate your own GAD-7 score. Ask yourself, how often have you been bothered by the following over the past 2 weeks? Feeling anxious, nervous, or on edge? Not at all, several days, more than half the days, nearly every day. Assign yourself a point value based on your response. Number 2. How often have you been bothered by not being able to stop or control worrying over the past 2 weeks? Number 3, how often have you been bothered by worrying too much about different things in the past 2 weeks? Number 4, how often have you been bothered by trouble relaxing over the past 2 weeks? Number 5, how often have you been bothered by being so restless that it's hard to sit still? Number 6, how often have you been bothered by becoming easily annoyed or irritable? Number 7, how often have you been bothered by feeling afraid as if something awful might happen? This should give you a score somewhere between 0 and 21. The GAD-7 is validated and widely used in healthcare settings. With your score, you can then determine if you have anxiety, the severity of your condition. Any score between 0 and 4 is considered just minimal symptoms. You have a diagnosis of generalized anxiety disorder if you score 5 or higher. 5 to 9 is mild anxiety. 10 to 14 is moderate anxiety. 15 to 21 is considered severe anxiety. What's the prevalence of anxiety in the general population? 18.1%, nearly 1 in 5 of U.S. adults are affected by an anxiety disorder each year. Nearly 1 in 3 adults, or 31.1% of U.S. adults, experience an anxiety disorder in their lifetime. Anxiety is very common as a mental health disorder. And this is a very concrete way to determine whether or not you're experiencing anxiety and how severe your anxiety might be.